Hey everybody, welcome back to the Chat GTM podcast. It's Michael Beck reporting here live from a beautiful day in Chicago, Illinois. We're in town for the National Restaurant Association show. And right now, in fact, we're standing across from the Middleby residential showcase at the Merchandise Mart, where our friends over the Prosper Forum are having their annual Prosper Accelerate kickoff, or their famous mixer they have, leading up to Prosper Forum and ultimately the Prosper Accelerate Conference. Today I'm joined with my new friend, Mr. Kobby Amoah. He's the CEO of River Health. Kobby, how you doing today on this beautiful sunny day in Chicago?
Doing great. Super excited to be in Chicago and to talk about healthcare and health benefits.
Healthcare and health benefits.
Yeah.
So before you get into that, what brought you here? What brought you to the Prosper thing? What's this about? I know that you were one of the invitees.
Yeah, so we're here at the Prosper program to meet other change makers in the food and beverage industry and to tell them about our innovative solutions in the healthcare space and how we can support them and help them support the employees. So super excited to be here at Prosper.
Fantastic.
Yeah.
And so River Health, just real quick for people that don't know you, what do you do? Who do you do it for?
Yeah, River Health is a unique health insurance company focused on providing quality health benefits to hourly workers.
Okay.
Most of our clients are in the food and beverage industry. We have a unique benefit design that allows workers in the food and beverage industry to access quality health benefits and healthcare starting at just $50 a month.
Oh, wow.
Yeah.
And so, you know, it's tough out there, right? The hourly workers, they can't get enough hours, and sometimes they can't get on health benefits, you know? Yeah. And it's cost prohibitive. So how did you come up with a solution so affordable that people couldn't use something like this?
Yeah, so our benefit design is unique, right? We just spent a lot of time thinking about the health services that hourly workers use on a day-to-day basis.
Yeah.
If you're an hourly worker working at a restaurant, you want to be able to go to urgent care when you're sick. You need to be able to get your prescriptions delivered to your home. You need antibiotics, birth control, everyday healthcare services. We decided to make those services available to members for $0 out of pocket. We started River Health because we realized that traditional health insurance today does not work for hourly workers, especially those in the food and beverage industry, right? The average health plan costs about $10,000 a year to offer. That's too expensive for hourly workers in the food and beverage industry. It's also too expensive for employers to offer that as well. So we designed a unique benefit solution that starts at just $50 a month that employers can either offer to the employees or they can actually offer it on a voluntary basis. So the employer doesn't have to pay anything. The employee can
so
cover
they can
the
subsidize
cost.
it.
Yes, they can subsidize it or decide not to. And it delivers real value to the employer, right? Employers are seeing a 22% increase in retention when they offer benefits from River Health to their employees. So that's the whole idea behind the company. How can we design a unique benefit solution for hourly workers in the food and beverage industry that's different from what traditional insurance providers will offer you?
Now the skeptic in me pops up and goes, well, for $50 a month, am I getting anything? What do you get for that? And it sounds like there's probably a lot if you're doing this.
Yeah, there's a lot in there. Now, so $50 a month is the first plan we offer. It's called the Essentials Plan.
Okay.
And as the name suggests, the Essentials Plan is designed to cover essential healthcare services only. So prescriptions, number one.
Okay.
So whether you want antibiotics, birth control, allergy medications, we have a formulary of over 7,000 medications available to our members at no additional cost to them. You can get your prescriptions delivered to your doorstep through a partnership with Amazon Pharmacy, all for free. And that's just the beginning.
So telemed is included in this.
Virtual care is also included. We employ the providers who deliver virtual care to our members. So if you're sick, you need a prescription refill, you have a healthcare question, you have a UTI, you can just get on the phone with one of our providers. You can do text, you can do video, you can do audio. The provider can see you, they'll write your medication, Amazon will deliver it, or you can pick it up at your local pharmacy, all at no additional cost to the member.
So Kobby, when you were a little kid, you weren't laying in bed going, you know, one day I'm going to open up a healthcare company.
Yeah.
What was it that sparked you? There's got to be some kind of personal tie-in, something that you want to solve for somebody you had in mind with this.
Yeah. I mean, most people have been hourly workers before. They've worked at companies that do not offer them health benefits, right? And I've been there as well.
Yeah.
And so that experience of going to the AC exchanges to try to find health insurance and realizing how expensive it is.
Yeah.
That's what got me thinking about a solution like River Health, right? And I was lucky to get great people to work with to build a solution like this and offer it to hourly workers across the country.
And is this intended for the bigger businesses, small to medium size? Who's this really geared for?
Yeah, we serve businesses of all sizes, right? Our smallest client has about 2 employees on the plan, all the way to some of our large national clients that we serve with 70,000, 40,000, 50,000 employees that we support.
What brought you to Chicago today? Why are you here?
So we're here to spend time with our friends at Prosper.
Yeah.
Prosper has been a great forum for us to meet operators in the food and beverage industry and tell them more about our solution and how we can help them save money, improve retention, and also deliver quality healthcare services to the employees. So that's why we're here in Chicago.
And do you only work with fast casual, chain restaurants and food, or are you in all kinds of different verticals?
We're in different verticals, but most of our employers, most of the clients we serve are actually in the food and beverage industry today.
How do you get to that number, that $50 a month as an entry point, right?
Yeah.
That number boggles me. I wish I could pay $50.
Yeah. It's all in the benefits design, right? So we decided to create different buckets of services that are covered under our plan. So if an employee wants to be able to buy everyday primary healthcare services, that's what's included in the $50 bundle, right? So you can see your primary care doctor, you can go to urgent care, you can get prescriptions, lab testing, and therapy. If you want additional coverage for catastrophic events like hospitalization, you're able to buy up and get those services as well. So by making the benefits, number one, portable, but also by breaking up the different services that gets covered, it allows employees to get health benefits at different entry points. So for someone who just has $50 to spend on health benefits, we have a solution for you. If you have $125 to spend on health benefits, we have a different solution for you. So there's an entry point for every hourly worker today.
And what if I have a doctor that I love, that I'm working with? Sometimes has to be in the formulary. How does it work with the programs you offer?
Yeah, we give our members the flexibility. If you have a provider you've been working with that you really love, we can actually add them to a system and you can see them with a River Health plan. And you don't have to find a new provider if you have a great working relationship with your primary care provider.
Wow. And so when you thought this up and you're thinking about these frontline workers, I keep coming back to this guy. You have to think that you know somebody that felt this pain. Was it you? Was it your family? Was it a friend? What made you so passionate about this?
Yeah, so, in a previous life, I worked on an open source social venture where we're all independent contractors. So we didn't have, an organization providing health benefits for us. So we had to go buy our own health insurance, get on the exchanges, and we just saw the prices, right? A sticker shock. You're spending hundreds of dollars every month, and you still have, a deductible of $7,000, $8,000 a month, and you just want to be able to access basic healthcare services. So that's the idea behind River Health. Let's make this modular so that you can pay for the healthcare services you need on a day-to-day basis. And if you want to add additional services, you can buy up and put that.
So people have their own conceptions and misconceptions of what actually is true or untrue in the healthcare space. What's a myth you'd bust about what you do and a bad or a wrong perception people have about what River Health does?
Yeah, I think the idea, far and large, is health insurance companies are trying to prevent people from getting healthcare. And the challenge is healthcare in general is expensive, and the current model doesn't work for most people. What we're trying to do at River Health is to build a new model that's focused on care delivery so that people can pay one price. There are no co-pays, no deductibles, out-of-pocket costs. So what you see is what you get, right? You pay $50 a month. We tell you the services that we're able to cover for that price point, and you're able to go in and get those services at no additional cost to you.
No copay.
No copay.
All right, hey everybody, it's Michael Beck with the Chat GTM podcast, reporting live, coming back for a second take here with Mr. Kobby Amoah, who is the CEO of River Health, and we've been spending a little bit of time around the Chicago area talking about what River Health does, but I want to find a place that was a little bit quieter without the L train banging by every time we had something good to say, because Kobby's got a lot of good knowledge he's dropping on us about healthcare. So Kobby, what is the idea behind River Health? And I know I've asked this question a couple different ways before. You talk about frontline employees. You talk about an insurance program with no additional costs. So if you're paying what'd you call it? The entry level is called what?
It's the $50 Essentials plan.
The $50 Essentials plan. I want to say that again because that caught my attention. Saying there's no co-pays with that for that package you have. You get to get the pharmaceuticals. There's a prescription plan in that. How do you make that possible? How do the economics work out of that?
So we have a unique benefits design. We have what we call preferred provider partnerships. So we go to one provider group or we go to one vendor and their preferred provider and able to provide us with great pricing. So for example, our $50 a month plan covers lab testing. So if your doctor orders labs and you could get that done, it gets covered. We have a partnership with Quest Diagnostics. Your partner, the only lab partner we work with, so we're able to get preferred rates from them. That's how we're able to make it work as well. We've also had to redesign the entire rails for delivering healthcare, right? When a member signs up for River Health, we issue them a River Health branded MasterCard. You show up to the clinic, you swipe your card, to pay for the care and you walk out.
Wow.
This allows us to remove the middleman from the equation, right? In healthcare, you typically have a claims adjudicator. This is someone who's taking the bill and adjusting it and paying the provider and then paying the insurance company. They also take a cut, right? But using a MasterCard in real time, we would remove that middleman. So we're able to do different things to really keep costs low for our members today.
So I had an experience a couple years ago. I actually had an expensive plan I paid from a major carrier.
Yeah.
And my insurance, every time I turned a corner, they go, well, you can't go in here.
Yeah.
You can't go in there. Or my insurance agent would go, well, you have to tell them you're doing this with your life. And some kind of, I actually had to falsify things under the program I had to actually get treated. Is that something that people have to work through when you're talking about River Health?
No, you really don't have to work through that, right? I think the biggest issue is usually employees or individuals sign up for insurance plans and they just can't read through the fine print, right? There are a lot of things buried in the fine print that no one reads. Everyone just accepts the terms. You sign up for something and then you think you're good to go. And what we've tried to do at River Health is to remove all the caveats, right? And so we upfront, we tell you our plan is $50 a month. We cover the 5 core services you get under that $50 plan. And that's it. There are no co-pays, there are no deductibles, no out-of-pocket cost. So if you use any of the services included in the plan, you're good to go, right? And you also know what services are not included in the plan.
Right.
So it's a great solution for a lot of employees and the food and beverage industry, hourly workers who just don't have the time to get on the phone with an insurance company, try to know where to go to get healthcare, try to renegotiate a bill. We try to make it extremely easy for them to get care when they need it.
And from what you said before, I want to make sure I get this right. If I need care, I don't have to go to urgent care or some off clinic. I can go to a regular place.
Yeah, urgent care is one of the options available to you.
Yes.
But you can also go see your primary care doctor as well. You can see an OBGYN as part of this. So if you need to get a well woman exam or an annual physical or you need to preventative health, right? Or you need a pap smear or you need a mammogram. These are all services that are included in the plan at no additional cost to the member. However, if you're in a hurry and you just want to go to an urgent care and just get seen right away, you can also do that with a plan as well. That's the beauty of the plan, right? It gives you options. So if you have to quickly see a doctor and then go pick up a shift because you have to work, you can be able to do that, right? It also applies to our prescriptions program. If you don't have the time to walk to CVS or Walgreens to go pick up your medication, that's fine. We can have Amazon delivered to you, to your doorstep at no additional cost. However, if you don't want to wait for Amazon to deliver it and you just want to walk to CVS to pick up your medication, you can do that as well. So a lot of flexibility built into the plans that we offer today.
So I feel like I want to get on River Health.
Hey, you should definitely sign up for River Health. Yeah, I'll be signing you up after this.
Beautiful.
Yeah.
So for people listening, what do you want them to know about what you guys do? What do you like? Because sometimes people have head trash of what they think is happening versus what's really happening. What do you want them to know? Yeah,
the biggest thing is we talk to a lot of companies. And their first reaction is, oh, we don't think we can afford to provide health insurance. Or health insurance is too expensive. We don't want to do it, right? And
isn't it required? You shouldn't.
Yeah, I mean, if you're a large employer with 50 or more employees, you're required, but to offer health insurance. But sometimes we talk to small businesses. We're like, okay, I only have 20 people. I'm not required to offer health benefits, so I don't want to do it. And the point we're trying to make is, yes, that was true maybe a couple of years ago. Things have changed. We've built a new system. You can offer health benefits starting at $50 a month. And if you have the budget to offer more benefits, we have different solutions for you to be able to offer more benefits to your employees. But at least for $50 a month, that's a good entry point for you to start offering benefits. And you're going to see an improvement in retention from offering health benefits. You're going to see a reduction in missed shifts. You're going to see a boost to employee morale. And we have data to support this as well, to show you a real ROI from offering a River Health plan to your employees.
And happier employees equal happier guests because they're not sweating what they have to go back home to, right?
Exactly. Spot on.
So we talked about the one employee with the $50 program. Let's talk about the employee with kids, wives. Or wife. Wife. Wife and kids.
Hopefully.
Exactly. How does that work for families?
Yeah, we have family plans as well. So you can actually add your spouse, your partner, or a domestic partner to the plan as well. You can add your children to the plan, and they all get their unique set of benefits, right? So if you add your kids to the plan and they need to go see a pediatrician, they can go see a pediatrician, right? Now the family plans cost more, but on aggregate it's discounted. But if you have kids, they probably are in the urgent care all the time because kids get sick all the time. but that's included in the plan as well. So it gives you that peace of mind that when, little Timmy is sick, you can take them to the urgent care. They can be seen by a provider. They can get the prescriptions they need, all at no cost to you.
Wow, that's just amazing.
Yeah.
Like I'm actually kind of blown away. I had no idea that something like
Thanks.
this is
Yeah.
available to people. And kudos to you for making something like this accessible or democratizing this to people, so
Yeah.
people aren't left out in the cold without being able to get good health care.
Yeah. Make that.
So when people hear this, if they want to talk to you, what's the best way for them to get a hold of River Health, start looking at that, or potentially enroll, or actually, what's enrollment like? How do you get started?
Enrollment is very easy, right? The first step, if you're an employer who wants to offer River Health to your employees, the first step is to complete an employee application. It takes about 5 minutes to complete. You just provide basic information about your company. We're able to integrate into your payroll system as well. If you use a standard payroll provider, we can pull a list of all eligible employees, reach out to them to opt into the plan if they're interested. If they opt into the plan, they can start using their benefits right away. So it's really simple to do. Most of the employers we work with are able to go live within 5 days, right? So from the
5
first
days.
5 days, they can go live very quickly, right?
Wow.
So in about a week, you can go from not offering health insurance to offering full health benefits, right, across the board. So that's how it works. And if you want to learn more, you can go to our website, river.health.
Okay.
You can either request more information, you can book a call with our team members on the growth team. They can walk you through the benefits we offer. They can show you some of our ROI analysis, and you can make a decision if this is a solution that's worth your time or if it's a fit for your population.
Again, I'm a little bit flabbergasted. That's absolutely amazing, Kobby. I'm thankful for people like you that are out there making the world a better place. You're doing something really truly good for people.
Thank you. Thanks for having me. It's been a great conversation.
Well, we need this. People need this. This is a core thing that people should have access to. If we're in this country and people don't have access to health, that's a sad thing. So I'm glad you're doing this for folks.
Yeah. Thank you. Yeah, it's definitely a great need, and I think we also want to support the frontline workers who do so much work. And we all go to restaurants. We all go to businesses with frontline workers, and they're the people we talk to, the people we interact with on a day-to-day basis. So we want to make sure they're taken care of. When you're sick, be able to get care. That's the mission of the company, and we've been executing on that for 5 years now.
So I know that you guys are you're heading back home from here, I believe, right? But you have some shows coming up pretty soon where people can meet you in person if they want to talk to you about this. Where are you going to be next?
Yeah, so we're going to be at the Prosper Accelerator Program event in Orlando, Florida. We're going to be at the Chain Restaurants and Total Rewards Conference, CETRA Conference in North Carolina. We also have an events section on our website where individuals who are interested in learning more can look at the events that we're attending, and we'll be happy to spend time with you and tell you more about our solution.
Fantastic. And that website again was river.health.
River.health. Super simple. Super easy.
I would have
to
got
reach.
confused going, where's the .com? So river.health, it's
River
that
Health,
easy.
yeah. The funny thing is, if you do riverhealth.com, it will take you to river.health too.
It's called a redirect, folks.
Yes, exactly.
Fantastic.
Yes.
Well, Kobby, thank you so much. I know you got a plane to catch. I appreciate you taking the time here with me. For people that are interested to find him, you know where to find him on river.health or at the Searcher Show coming up. Or if for some reason you can't find him, reach out to me. I'll track him down for you too and get you in touch with them, because I think this is a very valuable program that people need to know about. And if you know other people in the community that are hurting without healthcare options, this might be a great opportunity for them to get something for their family. And if you happen to have a business that employs people, this is something you should probably look at to take great care of your people so they take great care of your guests and enjoy the business and opportunity you provided to them. Kobby, thank you so much, man.
Thank you for having me.
Absolutely, absolutely. For now, the Chat GTM podcast here in Chicago, Illinois, signing off. We'll see you guys in the next one. Have a great day.